are going to hear some noise, just as I mentioned, the puppies are going to go outside. But welcome everyone. So we're going to go ahead and begin. I'm going to minimize the screen here. There you go. So if you are here today, you are here to for our session on immunizations. And so my name is Ana Celaya, and I am one of the education and outreach coordinators here at the Women's Fund. And I am super excited to be leading the session, but even more excited because I'll be joined by one of our volunteers, Anna Gray. And so Anna Gray is logged on, but she's going to go ahead and co-facilitate and start facilitating the session somewhere in the middle. So you'll get to meet her then. But thank you for joining, Anna. Super excited to have you. Now, as always, I am going to go ahead and turn off my webcam so that way you can focus on the slides and I'm not distracting you. So I'm going to go ahead and do that. There you go. And let me minimize the chat. There it is. Okay. Now, my sound sometimes can be a little funny, so don't be afraid to let me know if I sound a little faint. All right, so let me go ahead and tell you a little bit about the Women's Fund for those of you who don't know who we are. So the Women's Fund is a nonprofit organization that works with both women and girls in the Houston area, and everything that we do is to provide them with the necessary tools that they need to be better advocates for their health. And we do this through focused seminars, curriculum-based classes, and we also have publications that we provide to our community at no cost at all. And so we do have physical copies of these publications, but if you are tech savvy and you prefer to read publications on your tablet or on your phone, you can point your camera on your device on the QR code, and that will take you to the publications page where we have the PDF versions of these publications. Okay. So today we're going to go ahead and talk about what immunization is. We're also going to talk about how immunization works. We're going to go over the immune system, the types of vaccines, arguments against vaccinations, and finally we'll talk about the immunization schedule, and we will have time to recap and for you to ask questions. Now, again, I will be joined with by Anna Gray. She's amazing. She's a registered nurse, so we both will stay after the session and answer any of your questions, and I would suggest that you take advantage of her time and her being here. Now, my hope is that after the session, you're able to understand the immunization process and the role that vaccines play in it, that you are able to list the necessary vaccines for different age groups and special groups, or at least know where to find it, and that you're able to identify common vaccination myths. Now, before we jump in to talk about what immunization is, I do want to go ahead and go over some vocabulary words. These are words that I might mention, that Ms. Gray might mention, and so I just felt it was right for us to look at the definitions and be familiar with what these terms mean. And so the first term is pathogen, right? So pathogen is the scientific term for germ. So super easy, super simple, right? It's a bacteria, a virus, or other microorganism that can cause disease. Excuse me. Now a vaccine, which is often confused with immunization, they are sometimes interchangeably used. It's not immunization, but it is a substance used to induce the production of antibodies and provide immunity, right? And again, it plays a huge role in immunization, so we are going to talk about vaccines quite a bit in this session. Now, the last two words are antibody and antigen. They sound similar, so sometimes I'm sure you've confused them. So antibody is a blood protein produced to attack a foreign substance, and it's shaped like a Y. So you've seen images of it, you've seen it, and it looks like a Y. Now, antigen is a toxin or other foreign substance which induces an immune response. And so what's the best way to remember these terms? Because they kind of get confusing. I know I always confuse them, or used to at least. The best way to remember what these terms mean as we go through the session is that antibody has the word body in it. So it's what's produced in your body. Antigen rhymes with pathogen. So it's something that belongs to a pathogen or a germ, okay? So I hope this helps. Okay, so what is immunization? Well, immunization is the process whereby a person is made immune or resistant to an infectious disease. right? If you remember the definition for vaccine is just a substance used, but immunization is the whole process, right? And it's the process, again, where a person becomes immune or resistant to an infectious disease. And it can be both active or passive. So let's go ahead and look at those two. So we have active immunity and we have passive immunity. Now, active immunity results from exposure to an infectious disease, either by encountering it or through vaccines. And this is the one that we are somewhat most familiar to, but because of COVID-19, we might now be a little bit more familiar with passive immunity, right? So passive immunity is immunity that results when antibodies are passed from one person to another. And I'm sure you've heard of convalescent plasma donations, which is a form of passive immunity, right? So patients who are in the hospital and they're fighting COVID-19, one form of therapy is to give them plasma from someone who has recovered from COVID-19. And this plasma has antibodies, right? That protein that's produced in their bodies that can help them fight the disease. Now, what is the difference between active immunity and passive immunity? Well, active immunity is long lasting, whereas passive immunity is short, right? Or shorter than active immunity. It's only 1 to 2 weeks. And so in that example that I use for convalescent plasma donations, again, it's used for patients who are fighting COVID-19, but this doesn't mean that by them getting this plasma donation that they'll have immunity for more than 1 or 2 weeks, right? It's short-lived and it's for the purpose to help them fight the disease in that time, right? Hopefully they'll get better and combat it. Another example of passive immunity is also breastfeeding, which I thought it was awesome. If we needed more proof as to why women are so awesome, there it goes. Basically, when a mother breastfeeds their newborn child, through the breast milk, they pass their antibodies to the baby, and this protects them until they stop breastfeeding. Then, of course, they'll lose that protection, and then they'll have to get vaccinated to or be exposed to the disease. All right, so let's go ahead and talk about the immune system. I promise it'll be a short slide on the immune system, but I do think that we have to talk about the immune system to really understand the immunization process and to really understand what vaccines are. And so the immune system is divided into 2 parts, right? So we have the innate immune system, and then we have the adaptive immune system. And the innate immune system, or the innate immune response, is short. And it's quick. And as opposed to adaptive immune system, or to the adaptive immune response, which takes a while to, I guess, to use a good, to lack of better words, to be activated, or it takes time for you to see the fruit of its labor. So think about, for the innate immune responses, think about getting a cut, right? You immediately start to see some redness, some swelling due to inflammation. In a couple of days, you see a scab. So that is your innate immune response, right? It is super, super quick. Now you have the adaptive immune system, which again, it's slow. And this is when we start to hear words like antibody, right? So the reason why your adaptive immune system is slow is because there is some genetic modifications going on, right? Some genes are turned on, some genes are turned off, and that is going to help you fight a pathogen or a disease. And so here's this very complicated sort of diagram, but what I wanted to show you is all the key players in the immune system. And I guess all is a big word because there are some others that are key players in immune responses, but for the most part, these are those special cells that help you fight, right, these diseases. And you can see right here, I wonder if you can see my mouse or the clicker, you can see the B cell. B cells are named B cells because they stem from the bone marrow, and here are the little antibodies. And that is the goal when we talk about immunization process, for you to have these antibodies and be able to recognize a pathogen the next time that you see it. And then you also have structural defenses. I have to mention structural defenses. They're super important. That there's a reason why people are telling you, or healthcare professionals are telling you, wash your hands, right? Our skin is so amazing at protecting us that we kind of take it for granted. And so we have certain points of entries that are not as strong, right? or are a little bit of our weak points, like our eyes, our mouth. But still we have the respiratory tract that has mucus and our GI tract that has stomach acid that do help us fight these pathogens. So let's talk about vaccines. How do vaccines work? Well, vaccines are basically going to mimic a pathogen, and they're going to stimulate the immune system. And we call them, I guess, pathogen imposters. We can call them that. And the reason we call them that is because although your immune system can recognize them, and it does recognize them as a threat, it does not lead to sickness, right? It looks like a pathogen, it might be a pathogen, it has some parts of the pathogen, but it doesn't lead to severe symptoms. And that really is the end goal, right, of vaccines. It is a controlled exposure to a pathogen, so that way you can still get that immunity and that protection, but you won't get those severe symptoms, right? And so here's an image of a vaccine. And so the vaccine, again, acts like a pathogen imposter, or it has antigens. And the end goal is for you to produce those antibodies, as we saw in our image that the B cell produces, okay? So what exactly do vaccines protect you from? Well, they protect you from bacteria and viruses, because there are other types of pathogens, right? Fungi, which is my favorite word, parasites, et cetera, et cetera. But vaccines in particular protect you from these two, bacteria and viruses, right? So they protect you from bacterial infections and viral infections. And there are some differences between these infections. And so let me start with the bacterial infections. So bacterial infections, they normally start in one specific area, right? And so again, usually you won't feel sick all over. And so, people might be like, oh, it's just a bacterial infection. That's certainly what I did when I got a staph infection, which is also a bacterial infection. And so the thing about them, though, is that they can spread, and they can definitely get into your bloodstream and cause issues. And so for the example of staph infection, I know that I was told, hey, you need to go to the emergency room because this can get into your bloodstream. It probably already is. It can lead to you getting your leg amputated, and it could lead to heart failure, right? So those are scary things to hear. But the thing about bacterial infections is that they don't necessarily make you feel sick, right? All over, at least. They might cause some pain in certain areas due to inflammation or something like that. Now, for viruses, on the other hand, they do tend to cause discomfort all over, right? You have symptoms like diarrhea, vomiting, nausea, fever, flu. You might get this bacteria too, but viruses definitely make you feel sick all over, right? If you think about the flu, you do get a fever, right? You do feel pretty unwell. And so if you see that image too, one thing that's interesting about viruses is that they're not necessarily considered living organisms, but they definitely act like it, right? But they can only act like it if they hijack a cell, right? So in that image, right, you don't have to love about biology to understand how amazing this is, but you have viruses on top or around a cell, and the things that are orange there, that's bacterial load or bacterial material that's being injected to a cell. And basically these viruses are using this cell so they can reproduce, and then they're gonna burst out and they're gonna keep infecting other cells. And so that's why they make you feel sick, because they do cause cell death. All right, so let's go ahead and talk about the different types of vaccines. Yes, there's different types, I know. There's the whole pathogen vaccine, subunit vaccine, and nucleic acid vaccine. What does that mean? Well, whole pathogen vaccines are exactly what they sound like. They contained a pathogen, and that pathogen is either weakened or lifeless, right? You're not gonna get the full-blown pathogen. You're gonna get a weakened or lifeless pathogen, okay? And the good thing about these vaccines is they typically result in a strong protective immune response, and that is good. That's what we want, right? The only thing that when it comes to manufacturing, it can take longer, right? It must be tricky, right, to make sure there's a whole pathogen, but that it's weakened. So there is some, that's a con of it. And so here are some examples of vaccines that are whole pathogen vaccines. So you have smallpox, chickenpox, yellow fever, MMR, polio, rabies, hepatitis A, and influenza. Our next type is subunit vaccines. Now, subunit vaccines contain parts of a pathogen. So it might be a protein that's found in the pathogen, right? And because it only contains parts of a pathogen, it does induce an immune response that is relatively low. And so the way that scientists counteract this low immune response is that they add adjuvants. I don't know if I'm saying it right, Anna, correct me later. But they're added to the vaccine to boost the response. And she's gonna go ahead and cover this a little bit later, very briefly. And so here are some examples of those types of vaccines: tetanus, shingles, diphtheria, hepatitis B, and meningitis. I shouldn't have said the whole list, but yes, that word there. And so those are some examples. Now, the last one is nucleic acid vaccines. And these, and one of the reasons why I wanted to share the types of vaccines, y'all, is because we have been hearing a lot about the nucleic acid vaccines. And also because it's important to know what they're made of so you're not scared of them. And so let me know if it did scare you that I share this with you, but I hope it doesn't. But nucleic acid vaccines contain mRNA and DNA, right? Genetic material. And this genetic material tells your body to produce proteins that are found in the pathogen, and therefore your body then goes, oh, that's a pathogen and I need to make antibodies. And that's a good thing. However, these are relatively new and there's no vaccines that exist in humans. So I know we've been hearing a lot about the mRNA vaccine that's in the works. I think it's in phase 3. You know, that'll be a scientific breakthrough. I'm all for it, but do know that there's no vaccines right now that are nucleic acid vaccines in humans. So here are some examples that are approved in animals. So West Nile virus, pancreas disease, canine melanoma, and hematopoietic necrosis. And so I gotta give credit where it's due. I did get these images from this doctor. Her Instagram page is Science Not Uncovered. Now, one of the goals of vaccines, aside from active immunity, is herd immunity, right? When we talk about public health in itself. And so what is herd immunity? Well, herd immunity is the collective resistance to the spread of contagious disease. So, and the way that we get herd immunity is if a high proportion of individuals in an area are immune to the disease, right? The thing about herd immunity is that there is no one size fit all, and that's something that I have to stress. And so the more contagious the disease, the higher proportion of people that need to be immune, and this is called the herd immunity threshold. And so I'm gonna go ahead and show you an image for those that are visual. And so for the most part, whenever we vaccinate, we're trying to protect, right? So think about if something's super, super, super contagious, like you're going to need a larger safety net. And so here in this image, you see the blue are people who are healthy that are not vaccinated. The green, or I guess it's yellow, is the healthy vaccinated people. And then the red is the sick and not vaccinated person. And so if you look at the left, it's basically showing you what would happen if most people are not vaccinated, right? So all that in blue are people that are not vaccinated, that are healthy. There are going to be more of them, and so therefore that disease could spread more easily. Now on the right, if most people are vaccinated, you kind of form this safety net around the person that's sick because the others are vaccinated, and that's the people in yellow. Let me make sure I didn't get any questions. Okay, cool. Now, I did share a QR code so you can access more information on herd immunity as it pertains to COVID-19. Again, we don't know too much about COVID-19, but I do think it's an interesting video that kind of talks about the different, I guess, the different paths that this virus can take. So prior to vaccines in the US, things weren't, they weren't really good, right? Definitely these diseases that are now vaccine preventable did cause a lot of harm in the US. And so just with measles is super, super contagious. And so definitely nearly everyone got measles and hundreds died because of it, right? And then in 1921, more than 15,000 people died from diphtheria. And what's interesting is that only 2 cases of diphtheria were reported to the CDC between 10 years, from 2004 and 2014. And that's a huge difference from 1921. Now in 1964 to 1965, we did have an epidemic here in the US of rubella. I don't know if I'm saying that right, but I'm gonna go with it. And 12.5 million people were infected, and that's just wild to me. 2,000 babies died, and 11,000 miscarriages resulted from that epidemic. It does impact babies. I forgot these stats on the rate of, you know, if you're pregnant and you catch rubella, like what is the outcome? But it was pretty scary just to read. If I do remember it, I'll share it in a little bit. But anyways, the good news is that today, thanks to the vaccine, less than 10 people are reported to the CDC each year that have rubella, which is great. So here's the list of vaccine preventable diseases, and which is great, right? That's amazing. After sharing those stats, I think this is something that we can be very excited about. And here's also some stats from in comparing 2 years, right? In 1900, life expectancy was 47, and the leading cause of death was due to infectious diseases, right? And then in 2010, our life expectancy is higher, and the leading cause of death has to do with chronic diseases. And there's a lot of reasons why the life expectancy might be 79, but just looking at the leading cause of death, you can definitely say it's vaccines have something to do with it, right? So this is where we're going to talk about the arguments against vaccines, because I think we do have to address certain myths that come with vaccines. You know, a lot of people don't know what vaccines are made of. They don't understand the immune system, and that's okay. You don't have to. But again, it's okay. It's good to be familiar with these things. And so I want to go ahead and talk about arguments, but I'm going to go ahead and ask Anna Gray to join me for this part. So this part we're going to tag team, right, Anna? And then
Yes.
you can take over after that. And so I think the first one is going to be for you, just for everyone to know. My dog is running around, so sorry about that. It's okay. So in red, you're going to see the argument or the statement that's usually said. And then in black, you're going to see the fact, or I guess the statement that both Anna and I agreed on, like, okay, yeah, this is something that we want to say. Okay. So here goes the first argument. Go ahead, Anna.
All right. Vaccines contain chemicals like mercury, aluminum, and formaldehyde. That's argument 1. Now, the fact is that vaccines do contain those ingredients so that they can be safely administered. They're often used as preservatives, but these chemicals are in very low doses. And these chemicals are also exposed, we're often exposed to them in our natural environment. So they're not at a level that they're going to be harmful to us. And they're used to stabilize the vaccines.
Absolutely. All right. So argument 2, the natural way is better. Let the immune system do its thing. Now, this is something that I was telling Anna whenever we talked prior to doing the session, that I was like, oh, this is the thing. And it turns out that a lot of my friends sort of believe this. And so my fact to you is that remember that vaccines boost your natural immune system, right? There's nothing unnatural to them. And as Anna mentioned, there are going to be ingredients in there that are present in everyday life. We either eat them through food or what have you. And so nothing unnatural or nothing that isn't going to help you will be added to them. And so again, being able to introduce a pathogen in a controlled way without deadly symptoms, right, should be a part of your holistic plan. I get that we all want to eat organic. I get that we all might want to be careful in what we're putting in our bodies, but vaccines are definitely something that we shouldn't shy away from. And so I wanted to go ahead and share the immune booster slide that I made, and it's a checklist. So this is my fact to you, right? How can you boost your immune system in a natural way? Eat a balanced diet and limit sugar intake, stay hydrated, get enough rest and sleep, exercise and stay physically active, prioritize your mental and emotional well-being, and talk to your healthcare provider and get your immunizations. That's just me, right? So argument 3.
All right, argument 3. They also have side effects. That's a risk I'm not willing to take. That's the argument. Now here's the fact. Yes, all procedures and medications can come with risks. Vaccines are no different, but they are amongst the most regulated and safest. And so one of the things is that you have to look at whether the benefit outweighs the risk. And with the previous slides that we showed, we've seen a definite decrease in some very debilitating and deadly diseases because of us having mass access to vaccinations and immunizations. So definitely it needs to be part of your overall health plan.
Mm-hmm. Okay, so argument 4. So what if I don't get vaccinated? It's my choice. And so again, this is the argument. And so this is sort of fact, right? Yes, you are free to make choices. And it is fact. You are free to make choices, of course. But my thing about thinking about vaccines as a choice to that extent to where you don't have to get it, right? Is that it does put others at risk, right? So, and this is scary because it can allow a disease to spread and then get to you if you do not vaccinate, or get to your children if you don't vaccinate. And I think whenever we talk about choice and vaccinations, we often, yeah, you can make choices for your family. But the thing is, it would suck if this choice comes right back at you and affects you, right? And so, and another thing is that vaccines do not eliminate the disease, right? They're still out there. And so if enough people don't get vaccinated, it's going to result in an outbreak. And one of the things that Anna brought up in our call also is that, yeah, in Texas, there is a policy that allows you to, I guess, be exempt you from getting vaccinated, and I believe it's called a request of an exemption for reasons of conscience. But again, if you were to go that route, your child could be excluded from events, especially during a pandemic like the one that we're experiencing right now.
Argument 5. A preservative in vaccines causes autism. They're ruining our children. That's the argument. Here's the fact. In some instances, autism can be detected at birth and before the administration of any vaccines. Some scientific studies suggest that autism could be a genetic disease. Additionally, currently there is no scientific evidence that autism is caused by preservatives found in vaccines. However, we do know that the vaccines, again, protect our children against some of the deadliest diseases that have ever been known to man. And literally now, we have very, very low rates of anyone being affected by these by these diseases if they are properly vaccinated.
Mm-hmm. And so here is some information on like where this myth really started. And I just wanted to share it because again, I don't think I mentioned it, but I will send this presentation in a PDF version. And so that QR code you can access, the links you can access. And so this is just a little background of where that argument came, or where that myth came, sorry. Someone published it, or a physician published it, Andrew Wakefield, along I think other 12, 13 authors, can't remember how many. But basically, it was published and there were so many flaws that it was retracted, and then he cannot practice medicine. And then the sad thing about it is that although this was a flawed study, I would say it had a huge impact on I think it's probably the hugest myth, and people stopped getting vaccinated, but luckily it's going up if you can see that trend. So yeah, the QR code also has a page from pbs.org that you can access to read more about this. Now, Anna, this is all you. So just let me know when you want me to do next slide.
All right, next slide.
Mm-hmm.
All right, so we're just going to go over the immunization schedule, and you see you have the scan icon as well, so you'll be able to use that if you're tech savvy and have access to this immunization schedule. Next slide. Okay, so the first immunization schedule, just wanted to look at briefly, was the birth through 15 months. So with that, we have the hepatitis. Um, there's nothing showing. Just kidding. All right. So we have the hepatitis B. That's going to be your first and second dose. And then we have rotavirus, DTaP, Hib, pneumococcal, and IVP, which is your polio. Again, at 4 months, we're going to have some of those same vaccinations again: rotavirus, DTaP, Hib, pneumococcal, and polio. And then 6 to 15 months, hepatitis B, rotavirus, DTaP, Hib, pneumococcal, polio, influenza, MMR, your varicella, and your Hep A. And those are going to be your first dose on the MMR, the varicella, and your Hep A. Then we want to look at vaccines for young adults, for young children and adolescents. So starting at 18 to 23 months, we're looking at having your hepatitis B, your rotavirus, your DTaP, your fourth dose, and then 2 to 10 years, your DTaP, your polio, your MMR, and your varicella. 11 to 18 years, your DTaP, uh, meningococcal, sorry, mine went blank for a second. And then we're also looking at your influenza. So why do babies need so many vaccines? Well, the reason for that is they are more vulnerable because they haven't been exposed to germs before birth. Now, babies do receive passive immunity from their moms during the last 3 months of the pregnancy. So they actually are born with passive immunity that was passed on from their mom through the placenta. But what happens is after the children are born, then that begins to decrease. And so anywhere from 2 weeks up to a few months, that passive immunity is completely diminished. And so that's why it's so important that the children begin to be immunized on a proper schedule. Also, as mentioned earlier by Anna, breastfeeding does help because there are antibodies that are transferred to the baby by mom through breastfeeding. And so that does provide additional time for that passive immunity for the child. Infections are common among young children due to clustering of young children in families in school and preschool. And newborns and babies can have more severe symptoms to an infection that otherwise would not cause distress in someone else that had been exposed to that pathogen numerous times. Now, we often think that once we're an adult, we no longer need any immunizations. That is not true. So we're going to look briefly at adulthood, 19 to 49 years. And for them, the meningococcal and the HPV. And then for the adults that are 50 and older, we're looking at the shingles and also the pneumococcal vaccines. And influenza, again, yearly, especially if you're someone that has any type of chronic condition, they really want you to consider receiving that influenza vaccine on a yearly basis. And then also you want to get your tetanus, and you need to get a tetanus booster every 10 years. And we're in hurricane season right now, so that's really important. That's also known as lockjaw. Some of you may have heard that. So that's what that prevents. We have an adult vaccine assessment that you can click on, and you can take that. And it's also just discuss adult vaccines with your healthcare provider, your PCP. That's going to be your best source as well to determine what's going to be best for you. And during pregnancy, one of the things that you'll discuss during those prenatal visits And even before you decide to get pregnant, you should have that discussion with your caregiver about what vaccinations you already have, which ones you're going to need if you are considering pregnancy. Once you're pregnant, the DTaP or whooping cough vaccine and an influenza shot. And then postpartum, what shot should you receive again so that you don't accidentally pass on um, any um, any diseases to your child that you now have this newborn in the household. And antibodies can take 2 weeks to develop, so don't wait to get vaccinated, as this can have an impact on the health of your newborn. Work and travel. Okay. Well, one of the areas we want to talk about is for healthcare workers, daycare workers, teachers, some of the vaccinations that many of them will need. And it depends on the organization that you are employed with. It's going to be the hepatitis B, the flu shot, the MMR, varicella, the DTaP, and the meningococcal. And then if you're going to travel, one of the things you want to include as far as your travel plans is to determine what vaccinations you will need based on what part of the world that you're going to. Cholera, malaria, yellow fever, the JE vaccine. But again, it just depends on where you're going to go. And again, your doctor or your local health authority can be useful in determining what vaccines you're going to need if you're planning to travel. Immigrants and refugees, part of that process when you come to a new country, you're going to be exposed to diseases that you may not have been exposed to in the area of the world that you're traveling from or that you're immigrating from. So the CDC recommends that the vaccine must be age appropriate for the immigrant applicant. It must protect against a disease that has the potential to cause an outbreak, and it must protect against a disease that has been eliminated or is in the process of being eliminated in the United States. Where to find vaccines? Vaccines can be found at your private doctor's offices. We talked about PCPs. Also, local pharmacies like Walgreens, CVS. Workplaces will often provide vaccines. Community health clinics, health departments, schools, as well as faith-based centers. And there are also federally funded health centers that can provide services for the uninsured and are income-based. So that means that they're going to use a sliding scale to determine the amount of money that you would need to pay for those services. And we have a link here so that you can click on how to locate a local health center near you. As well, one of the things we wanted to share is that Texas Children's Hospital Mobile Immunization Unit, right now they're offering free immunizations by appointment only, and it's for children ages 0 through 18 who have either no insurance or who have Medicaid. And to make an appointment, you just need to call 832-824-6355. If you get an answering machine, please leave a message and they will return the call. Like I said, it's by appointment only for children ages 0 to 18 years who either have Medicaid or have no insurance. Next slide.
Ooh, awesome. Thank you, Anna. So this is the end of our session. So before we get to the questions, I just want to go ahead and give you a class recap. Remember that vaccines allow us to avoid severe symptoms and even death and are an important part of immunization. There are different types of vaccines, and they're all designed to boost your immune system and to protect you. Before vaccines, infectious diseases were the leading cause of death. And outbreaks of vaccine-preventable diseases can still occur, and it's definitely a real threat. And so just make sure that you're familiar with what immunization schedule, what immunizations you need to get next. And also the holistic approach involves boosting your immune system mentally, emotionally, and what we're doing the vaccines. So let me go ahead and go here. So if you have any questions, you can either enter it in the chat or you can enter it in the chat. And again, Anna is going to go ahead and stay behind as well. If you think of any questions after You can email me at healtheducator@thewomensfund.org. And it's not only me, it's also the rest of the program team. And then if you have any questions, particularly for Anna Gray, I'll go ahead and send it to her. And as you're thinking about the questions that you want to ask, I do want to go ahead and share our survey with you. You can point your camera on your device on the QR code, and that will take you to our survey. You can let us know how, you can just give us some feedback, what you think, or what kind of things you want to listen to. Now, if no one has any questions, I will go ahead and share with you what events are coming up next. And these are our social media pages. You can follow us on Facebook, Instagram, Twitter, or TikTok. And again, these are the events that we have coming up. So I'll wait for some questions.